Hello, anatomy friends. This is Dr. Alsip, and in this video, we will be discussing the viscerocranium, which is just the fancy word for the facial skeleton. Here are your learning objectives. Please take time at the end of this video to answer these in your own words. If you can do that, you're in a great spot there. And as mentioned, the viscerocranium is just the facial skeleton. And these are the bones that are going to surround the mouth, the nose, the eye. So it's going to be around these structures here. And these bones change dramatically during the first 2 years after birth, but are typically done growing around the age 16. And most of these bones are categorized as irregular or irregularly shaped. There are a total of 14 bones, so let's discuss them individually. And we will start with the paired nasal bones, which form the bridge of the nose. And if you think about it, these are the bones that the bridge of the glasses will sit. It's these nasal bones right here. They're relatively small, they're mostly flat, and their main function is really to protect that superior entry of the overall nasal cavity. One of the most complex of the facial bones is the maxillae or paired maxillary bones. This bone does a lot. It's often called the upper jaw because it houses our upper or maxillary teeth. It will also form the majority of the hard palate. If you're able to move the tongue to the roof of your mouth, kind of feel around up there, you will likely be feeling the maxillae deep to the more superficial tissues. And internally, the maxillae are mostly hollow. So if I were to take away this bone right here, I'd be looking at a mostly hollow space because this is the location of the maxillary sinuses. So let's talk a bit more about sinuses. So sinuses are part of a complex. Overall, these are all called paranasal sinuses, and these are going to be mucous membrane-lined cavities that are near and associated with the nasal cavity. And so the secretions from the mucous membranes of these sinuses will drain into the lateral nasal wall, and so the nasal cavity. The sinuses also function to reduce the overall weight of the skull. So imagine if the whole maxillae or maxillary bones were completely solid. That would be a good deal more weight than if it was completely hollow within. Additionally, the sinuses serve as resonating chambers that can enhance the quality of your voice. So think about this. Think of when the last time you had a pretty severe cold. Does your voice sound different? Well, it probably does because those passageways through which sound travels into and out of the sinuses, they become blocked by excessive mucus production, and that will change the quality of your voice. So that's why you sound differently when you have a cold. There are paranasal sinuses in more than just the maxillary bones. You also have rather large sinuses in the frontal bone. There is also going to be a sphenoid sinus. And there are multiple sinuses that are small in the ethmoid bone, and these are often referred to as ethmoid air cells. So sinusitis is just simply put the inflammation of the mucous membrane of one or more paranasal sinus. Generally, the most affected are the maxillary sinuses. So if someone says that their sinuses are acting up, it's pretty likely to include the maxillary sinuses. That's the likely paranasal sinus that's being affected, and there could be more. Common symptoms of sinusitis include facial tenderness, particularly around those bones. You obviously can have nasal congestion, post-nasal drip, and headaches can come from these. Speaking of the lateral nasal wall, where those sinuses drain, you also have these uniquely shaped bones called nasal conchae, or sometimes you hear them referred to as turbinates. Concha means shell, and so this is really well named. These bones kind of look like concha cells. There are three pairs. The superior and the middle nasal conchae are actually components of the ethmoid bone, while the inferior nasal concha is its own individual bone. It's its own independent bone. But these three really have similar functions. Now, it may seem counterintuitive to have bone in an already tight nasal cavity region, but these bones are covered with mucous membrane, and so that allows for an increased surface area in the nasal cavity. And the turbulence caused by these bones with the inhaled air as it comes in allows that air to warm and humidify. So there's several functions here. Your cheekbones are called the zygomatic bones. These form the lateral wall of the facial skeleton, aka the cheek, so you can easily palpate the zygomatic bones in that region. But the zygomatic bones also form a good amount of the floor of the orbits. The smallest bones of the face are the lacrimal bones, which are in the medial wall of the orbital region. There is a depression in the anterior portion of the lacrimal bone that matches up to a depression on the maxillae to form the lacrimal fossa. And it's in this region that tears will collect and that will eventually drain towards the nasal cavity. So lacrimation is involved with production of tears, so that is where these bones get their name. Next, we have the unpaired vomer, which this bone's main function is forming the inferior portion of the nasal septum. So let's pause on this concept of the nasal septum real quick. The nasal septum will divide the nasal cavity into mostly equal right and left sides. So again, it's formed inferiorly by the vomer. Superiorly, this is going to be formed by a projection of the ethmoid bone, called the perpendicular plate of the ethmoid bone. And anteriorly, it is formed by septal cartilage, which is hyaline cartilage. Oftentimes, when someone breaks their nose, it very often involves this septal cartilage rather than the actual bone, although we know it certainly can fracture surrounding bones as well, depending on the severity. And a deviated nasal septum is a deviation of the nasal septum. So to a little bit to one side or the other. And these deviations often occur at the junction of the septal cartilage and the vomer. The paired palatine bones mainly function by forming the smaller posterior portion of the hard palate. The maxillary bones, remember again, are going to form the majority of the hard palate, and it's going to be more anteriorly located. And the soft palate will actually attach to the palatine bones and extend from there. The palatine bones actually form a very small component of the nasal cavity and a little bit of the orbit as well. But again, the primary function is part of the hard palate. Last but not least, with bones of the viscerocranium is the mandible, which is an unpaired bone, although it did start as two bones that did fuse, so you form a synostosis here. It is the only movable bone of the skull, and this is movable at the temporomandibular joint, or TMJ. But there is one exception in terms of movable bones in the skull, and that is those ear ossicles within the middle ear. The mandible is often referred to as the lower jaw, as it is the bone that houses the lower or the mandibular teeth. And there are two major parts of the mandible. There will be the body of the mandible. So it has it going all the way over here in terms of the body. So this is going to be U-shaped for the most part. So you can think of there being the other portion of the body on the other side of this mandible. And it is going to be more horizontally oriented and also located more anteriorly. Whereas the ramus of the mandible is the vertical, more posteriorly placed portion. And it has some superior projections that we want to talk about and get to know better. So the more posteriorly placed projection is going to be called the condylar process. And on the end of that condylar process is the mandibular condyle. And this is the portion of the mandible that will articulate with the mandibular fossa of the temporal bone. So this is the mandibular portion of the TMJ. Anterior to the mandibular condyle is the coronoid process. This is the insertion site of the large temporalis muscle, which is one of your main muscles of mastication or chewing. The mandibular foramen is going to be located on the interior side of the ramus of the mandible, so the more medial side, and this allows for passage of the inferior alveolar nerve, which is the nerve that provides the sensory innervation to your mandibular teeth. So if you've ever heard of an IAN block, this is injecting anesthetic right around this region of the mandibular foramen in order to block sensation to the teeth. We're going to end this video with a discussion on teeth. Now, teeth are not bone, although that is a common misconception, but it's so closely associated with the skeletal system that we are going to discuss them here. There are 4 types of teeth. Incisors are going to be anteriorly located. They usually have thin cutting edges. The canine has a single prominent cone that can get worn down with time, but is generally pretty prominent. These are the teeth that are very developed in, say, a dog or a vampire, if you've seen that before. Premolars are also called bicuspids. They have 2 cusps. This is where bicuspid comes from. So bi meaning 2, 2 cusps. And molars have 3 or more cusps. And the amount of teeth depend on ages and life, and of course there's variation. So a complete set of adult teeth or adult dentition include 32 permanent teeth. And you may see this equation-like setup here, 2, 1, 2, 3. This is showing how many of the types of teeth per quadrant. All right, so only a quadrant of the teeth. Of course, we know there are 4 quadrants in the mouth. So this means that there are 2 incisors, 1 canine, 2 premolars or bicuspids, and 3 molars. And again, there can be variation among individuals. Say if a person has had a tooth removed or a tooth doesn't develop at all, such can occur in individuals that never develop their 3rd molars, which are often colloquially referred to as the wisdom teeth. For a kid or juvenile with a full set of teeth, there will only be 20 teeth, which makes sense as the bones associated with the juvenile skull are going to be quite a bit smaller. These teeth are often called deciduous teeth, or sometimes you hear primary teeth, or just simply baby teeth. The equation here is going to be 2, 1, 2. There are going to be 2 incisors, 1 canine, and 2 molars. Note, there are not premolars in juvenile dentition. And there will be 1 less molar. So there are no 3rd molars or wisdom teeth here because presumably once you're an adult with all your molars, you have more wisdom. That's where the name comes from. All right, excellent. We have reached the practice question. So what do you think about this one? Most of the hard palate is composed of which bone or bones? Pause the video to think through, and when you're ready, let's discuss this answer. Hopefully you remember the hard palate is made up of 2 types of bone. So that would be the maxillae and the palatine bone. So we just need to remember which one makes up the majority. And even though palatine bones have palate right in its name, it's actually the maxillae that form the majority of the hard palate. So the maxillae are going to be anterior, forming the majority, and the palatine bones are going to be more posterior. The ethmoid and the vomer are going to be portions of the nasal septum, but not the hard palate. And then the mandible, that's going to be the lower jaw bone. So not the hard palate, that's more associated with the upper jaw. So that's not correct either. So all signs point towards C, maxillae being the correct answer. Hopefully that made sense and you're feeling good about your knowledge here. If not, no worries. Just go back and review the video and answer those learning objectives in your own words. Thank you so much for your time and attention.